Matt is a healthy 28-year-old and he works part-time and he's finishing his last semester at Cal State Fullerton. He doesn't have health insurance because he can't afford it. He ended up getting into a motorcycle accident, and as a result of not having insurance, his medical bills ended up costing him over $100,000. Not having health insurance is problematic because people that don't have insurance don't go to the doctors when they're sick, and they don't fill prescriptions due to cost. So today, I'm going to inform you of the features of the Affordable Care Act and the available options for workers earning less than $20,000. According to the Commonwealth Fund, which is a private organization that supports independent research, in 2012, there were 75 million Americans that did not have insurance. They were struggling to pay off their medical bills or were paying them off over a long period of time. Also, Phil Gallowitz, who writes for the Kaiser Health News Foundation, on April 26, 2013, he reported that there has not been a large statistical decrease in the amount of uninsured Americans. Catherine Hollander writes for the National Journal, and she informed us on August 27, 2013, that there are actually government subsidies to help make insurance more affordable. Now, the NPR, which is the National Broadcasting Radio Station, reported that on April 1st, 2013, beginning in January 1st of 2014, there's actually going to be a penalty if you don't have health insurance. So today I'll inform part-time workers that are earning less than $20,000 of the options available through the Affordable Care Act. First, I'll inform you of the features of Medi-Cal. Second, I'll inform you of the features of the Silver Package through Covered California. And third, I'll inform you of the features of the Bronze Package. So I'll start by informing you of the features of Medi-Cal. There are three major factors that determine if you're eligible for Medi-Cal. According to the Department of Healthcare Services, which finances and administers Medi-Cal in California, if you're an individual between the ages of 19 and 64 and your income does not exceed 138% of the federal poverty level, you're eligible for Medi-Cal. That's about $15,800. Also, according to Covered California, which is the government's website for insurance in California, if you're a child and your family does not earn above 250% of the federal poverty level, which is about $48,000 for a family of 3, you're eligible to receive Medi-Cal. They're also further expanding to include individuals even if their income slightly exceeds the poverty level. Now, Medi-Cal is a preventative care-based service, and they focus on two services to help promote their patients' well-being. First, they cover a core set of services including medical care, hospital visits, and pregnancy-related services, and they're expanding so that they can include nursing home facilities for individuals that are over 21 years of age. Also, according to Covered California, that was previously qualified, they're expanding their substance abuse-related care as well as their mental health-related care. So now that I've talked to you about the features of Medi-Cal, I'm going to talk to you about the features of the Silver Package. Now, the Silver Package is broken down by your income, and they have a sliding scale. So based on the sliding scale, there's only 2 tiers that are available for you if you're earning less than $20,000, and that's what I'm going to go over today. So the first tier is for individuals that are earning between $15,800 and up to $17,200. Now, if you qualify for this plan, there's no deductible for medical care. Also, because of the government subsidies, your medical copays are going to be a lot lower. They're all under $10 except for an emergency care visit, which is $25. There's also going to be a maximum out-of-pocket fee, so the most that you'll pay for that year for health service is $2,250. Now, the second tier of the Silver Package is for individuals earning between $17,200 and up to $22,800. Because your income's slightly higher, there is a $500 deductible, which means that the insurance that you choose requires you to pay $500 on a medical claim before they'll pay the remaining cost. And again, because your income's slightly higher, your copays will be a little bit higher as well. However, they still will be affordable because of the subsidies. But your maximum out-of-pocket is going to still be the same, which is $2,250. So now that I talked to you about the features of the Silver Package, I'm going to talk to you about the features of the Bronze Package. So the bronze package is also available for you if you're earning less than $20,000. And it's a little bit higher of a plan, so there's going to be a $5,000 deductible. And also there's still going to be a maximum out-of-pocket of about $6,300. So because of the maximum out-of-pocket, if you do have to file a medical claim, the insurance is going to require you to pay $5,000, but it's not going to exceed the $6,300 for the year. This plan is more ideal for somebody that doesn't get sick very often because their monthly payments are lower. But when you go to see a doctor or get medical help, they're going to try to balance that cost out, and your copay is going to be a lot higher for you. But if you're only going once a year, then it still is more affordable for you. But it does make it so that you're not going to be penalized for not having health insurance. And if you do get into an emergency situation, you will have insurance and you won't be responsible for the 100% of the medical cost. This plan actually covers 60% of medical fees. So you would be responsible for 40%, but it won't exceed $6,300. So now that I've talked to you about the features of the bronze package, that concludes I talked to you about the available options through the Affordable Care Act if you're earning less than $20,000. First, I talked to you about the features of Medi-Cal. Second, I talked to you about the features of the silver package. And third, I talked to you about the features of the bronze package. So now when you go to choose health insurance within the next couple of months, you'll be more informed about which option is most suitable for your needs, and you won't be able to you won't be likely to get into large debts because you don't have health insurance or be struggling to pay it off over a long period of time. Thank you.